Of course, my name is Jim Leba. I'm the host of Hemp Helps, and I've got my two sidekicks and partners in crime here.
Jerry Ra.
And Steph.
And tonight, what we're going to do is we're going to break it up a little bit. Steph's going to go over a few things that are in the news. What we want to do is kind of bring what we see that's happening in the industry out there. Always at the beginning of the show, we'll get you updated, on things that you can look at. It could be anything from stocks, it could be anything from news from a company to whatever it might be. Tonight, after we get done with that, Jerry is going to go over with these are some of the products that I live with on a day-to-day basis after breaking my neck 7 times and severing my spine. So we'll kind of give you an idea of at a higher level spot where I'm at, what I have to use it for, and the times that I use it for. And then he's got some other stuff that he wants to go over as well. So we'll go ahead and start with Steph.
Jump right in it. So
Yeah.
what's going on in the news today, Steph?
Okay, so I was reading some news articles that I thought were really interesting.
Mm-hmm.
The first one is titled "Everyday Marijuana Use Reduces Opioid Consumption by Chronic Pain Patients," a study finds, which talks about a number of studies that have shown that people dealing with chronic pain issues find themselves substituting medical marijuana for prescription painkillers. And according to new research out of this week, they're also using cannabis to replace opioids that weren't prescribed by a doctor, such as heroin. I think this is a big deal because people
Absolutely.
sometimes fall like in these major drugs,
Mm-hmm.
maybe looking for like seeking relief of pain,
Exactly.
because maybe they don't find the prescription of doctors that they need for maybe more a better drug
Right.
for them.
So, I mean, I'm gonna jump right in there right away, and as you know, there's an opioid addiction going
Mhm.
on across our nation right now. And Jim, I mean, you're prime to this. When you had your accident, I'm sure you were prescribed some opioids, and you
Yep.
decided to. What were some of the opioids that you were prescribed, and then why did you decide to choose a different path and go with some CBD products?
Well, I mean, I've been injured since I've been in my early 20s, so I've been living with it for a long time. The severing of my spine when that came in about 2004,
Mm-hmm.
made a huge difference in my life with the ability to somehow try to get myself back onto my feet. I was almost a full quad from the neck down for almost 37 weeks.
What type of opioids were you first prescribed?
Well, they had me on, combinations. I mean, they had me on a high dose of Percocets,
Okay.
plus, almost they were moving their way on. The next one would have been the 100 milligrams of a fentanyl patch.
Wow.
I didn't want to stay at that same level.
Hmm.
As far as what they were doing, I was on morphine. I've been on, everything possible that you can take.
And kind of tell our audience, for those who haven't experienced opioids, even though many of us, when we've had our breaks and our traumas during some of the accidents we've had, how did that affect you from your day to day living, and then kind of
You
go
know,
into when you decided to start using a hemp oil or a CBD.
well, I think it's first of all, I could never be, a good pill addict because I have a hard enough time remembering to try to take my pills. But
Right, right.
thank God my wife,
You
lets me
you
know
had
before
the
I run
Monday
out the
through
door.
Tuesday little pill pack
Yeah,
that you
exactly. Yeah,
on Monday, Tuesday, Wednesday.
yeah, exactly. Yeah, I need something like that. So,
Right.
but um, the opiate side of it, I never really understood like, how somebody can take a pill and it does something to them
Hmm.
because like I've been taking either I've just been taking opiates for so long that it doesn't affect me like it affects other people, but like with the burning in this arm,
Hmm.
when I take it, it's just gonna like put it to the spot like where you just don't want to like have to kill somebody. You know what I mean? It
Yeah.
just it
I
just
understand.
drops you below the level where you're somewhat okay. I can handle this. I know it's there, but I can
Hmm.
handle it. And so I knew that I didn't want to keep going up. I mean, they had
Hmm.
tested me at one time that I was getting a little bit of a liver problem.
Right.
And, he said it wasn't anything really to worry about right now, but we need to look at something different. and and
Say
that's
5, 10 years down the line, it
yeah.
would have started really
Well,
affecting
and
the
a lot
liver,
of them,
right?
they use a lot of aspirin that I've found out, but I'm not scientific on that side of it because I really don't believe in a lot of the pharmaceutical drugs. But it's sad what they've done because they've become obviously the largest drug dealer in the country.
Exactly.
So they make one pill and then they make another pill for you to do whatever it's going to do. But like in my regiment, um, because I don't even bounce off of like if I'm supposed to take a pill at 8,
Hmm.
I don't take it at 6.
Right.
So like with the burning of my arm, like our roll on that we have,
Hmm.
I don't care if you're an athlete, I don't care what you are, if you're picking up laundry baskets, this product is a dream,
Okay.
an absolute dream. This I put it on my arm, I put it on when we were
Mhm.
driving down, and I'm
Let me see that.
comfortable right now.
Okay. And
Okay,
you're comfortable, right?
yeah,
And I think
So.
sometimes without going any further, nothing like big, like
Hmm.
accidents or anything. Um, for sleeping aid, I was reading that scientific community is still not sure, but marijuana actually it's been like proved that it can help treat the sleep problems.
yeah.
So people that have maybe you don't need to go to the doctor for that.
Right.
Maybe you just feel that you just need a little bit of help.
So we got, we have sleep aids over the counter, and now we have, a new um, benefit coming to the market. And once again, I just want to
Mhm.
bounce back to, once again, when you're on opioids, and what was your sleep like? Were you getting any sleep on the opioids compared to when you decide to switch over to these products here
No, I do much better sleeping on this side than I do on the other side.
on the other side?
I mean, the
Okay.
worst part that you get, obviously, with any medication that you take is constipation.
Okay.
Even though
Constipation.
99% of all constipated people couldn't give a shit, but
Right.
but at any rate, there we go, the ding for the one.
Ding.
But, so it does change, how it affects your body and
Right.
the stomach and everything else because obviously CBD is very good for the autoimmune side of it.
Right.
And even like we were talking about the other day, that Michael that used to be on one of the cooking shows that just came out with a great book that I want to try to see if we can get him on the show and talk to him about it.
Mhm.
Where cooking with all anti-inflammatory stuff.
Yes.
So
Yeah.
it's this is
Got to be
really
important.
yeah, it's really the important aspect of it. So this I use to take care of the pain when I need it on quick spurts. Okay,
Mhm.
the tinctures. I take the tinctures. What's interesting is I only have one good hand that works.
Okay.
So 90% of the time, if I'm opening something, doing something, it's my
Mhm.
teeth and my
Okay.
hand.
Okay.
So a lot of times I'll get like some pain in my teeth from using it too much like that.
Uh huh.
And all I got to do is just put a little bit of that tincture in there and just let it sit in my underneath my tongue.
So tell us a little bit more about tinctures. What are they? What's involved in making a tincture, and why is it more potent than just regular CBD oil or even
Well,
isolate
yeah,
compared to the full spectrum?
it's gonna come out as an oil just like any one of the other oils. It's a
Right.
matter of if you're buying the CBD how we talked about it either through an isolate, through a full spectrum or a broad spectrum.
Mhm. Mhm.
So so a lot of times I'll put that in at night just to help my teeth feel better when I'm sleeping at night.
And when you say put that in, are you
You
taking
see,
it under your tongue?
yeah,
How are
yeah,
you?
it's got a dropper in it.
Right.
So basically, I'll take one full dropper and I'll just squirt that underneath my tongue, let it sit there for about 30 minutes so that you can start to feel when it starts to bubble.
Uh
Mhm.
huh. Uh huh.
And I'm kind of stuck on the chair here, sorry. So so that's going to take away a lot of that pain. Now, earlier when I came down here tonight,
Mhm.
I use this a lot.
Yeah, I was shocked about how fast the effect was.
You know,
Mhm.
So he put it on, and like 5 minutes later, I asked like, "Do you feel something like any relief or something?" He was, "Yeah, like 50%. What wait, was it? 50% of your
yeah,
pain? Yeah, it's gone. The burning
50% of the
of
burning
the
that's
burning
yeah.
gone.
is gone."
And I'll use this even for a headache.
Right. Right. So right
I
into the
take it and I roll
temples.
it across the top
Mm.
and then over on the other side, and
Mhm.
and in 2 minutes your headache's gonna be gone.
Oh, nice.
So
Wow. Wow, wow, wow.
Every man
So,
needs that.
depending on who you're dealing with.
Before you go home, use.
So, let's get into we got a plethora of different types of medications that you are taking CBD wise. This one is called Dew Drops. It's 500 milligrams. Is this a full spectrum or isolate? And can you kind of tell us what's the
Yeah.
difference between full spectrum and isolate? And I know our audience out there, but this tends to look more like a full spectrum to me. It's a dark,
Yeah.
cloudy. If you could kind of zoom in on that look or whatnot, can just go into that a little bit, and then
Yeah.
how you take it and why do you take it?
Well, I take this one because I'll tell you something. This one has a very if you put a little dropper underneath your tongue of it,
Hmm.
this has a very sweet taste to it.
Oh, nice.
Okay, it doesn't taste like some of the other ones that I've bought on the from competitors out there that literally they taste like bong water. They taste horrible.
Uh huh.
So there shouldn't be any reason today why somebody can't make a product that tastes well because we figured out how to be able to make water soluble the right way
Right.
with no taste, the right conditions for no fogginess, any of that type of stuff, so that we can come out with a good quality product. And so that's really the key.
So difference between isolate and full spectrum
So
or distillate. I'm sorry.
yeah. So when you actually take the plant itself, the CBD plant,
Right.
okay, when it goes through the extraction process,
Hmm.
they're going to be you're either doing if what happens first is a lot of times they'll take like the stock of the hemp and all of the stuff and they'll
Right.
take that and they'll turn that into crude.
Hmm.
Then from crude they'll take it into another lab and they'll start to clean up that process. So that you can determine when it's called an isolate, it's exactly kind of what the meaning is. You're isolating just this particular component, and that's it.
Okay.
So there's absolutely no THC, nothing, involved in that.
It
Well,
tends to be a little bit clearer as well, right? Than the full
it,
spectrum,
well,
or not so.
no, it just
It just
depends on
depends.
what other additives that the company's putting in. So if they're putting
Okay.
in a flavor, then it's obviously going to adjust it a little bit,
Right.
to how it is. But for the most part, yeah, you're right on the concept of what you're thinking. It's just
Okay.
a matter of what that particular company feels that they want it to be as their end result of it. I've tasted enough of them on the market to know Hemp Meds is a real strong company. They've been around for a long time. They make a great product. I mean, I can only sleep on my left shoulder, so my left shoulder gets very painful. So,
Hmm.
so then I'll get this massaged into my shoulder, a nice salve.
Uh-huh. So that's really quick for our audience out there. Basically, what you're saying is you take a combination of things depending on what your pain level is and what your pain is
And what
calling
time of
for
day it is.
and what time of day it is.
Yeah.
So you're on your ride down here. You said, hey, Steph, I'm going to put some of this roll on, and boom, you put it on. Within 2 minutes, everything starts to loosen up. You're able to drive on your way.
Yeah, because
You didn't get high, did you? Because
no.
that's what everybody wants to know. Are these products making you high
Well, this
while
is
you drive?
100% hemp.
Okay.
This is
Okay.
100% hemp. This is 100% hemp. This is 100% hemp.
Okay.
So
So no high.
So
Yeah.
no high.
no,
No high.
all gone pain.
I don't know.
No benefits from the other side.
Okay.
It just takes care of the pain.
So then just moving forward. Boom, you did that. You said, Jerry, I can't sleep on my left side. And it gets pretty tight. Then that's when you move to your more liquid in the
No, no,
mouth
no.
under the tongue.
I'm gonna take the salve
You're gonna take the sack.
and I'm gonna
Okay.
rub that in really good because the salve, what it's gonna do is it's got a lot more when it starts to heat into the skin and
Mhm.
and everything like that.
Mhm.
And when you utilize it, this has a tendency to stay on your arm for probably about a good 5-10 minutes
Okay.
before it dries in,
Mhm.
and then you come back with a lotion over that, and now that will start to help push it down. Anywhere from that
Into
two,
deeper
three, four
levels.
levels of skin versus the standard 1.5, 2 that you see most of the products that are on. When you go into CVS that aren't aren't really ones that work that well.
Right.
And
Right.
about that, do you need to like to have any issue to really use the products? Because you were telling me about the lotions and the shampoos and all of it. So
Hmm.
I, without having any like illness or problem, can I just use them? Are they beneficial in any way?
Well, it's funny. 2 days ago, United Healthcare sent their person out, and I was talking to him about the products that we have and that type of stuff. And I said, listen, we got a good shampoo. I said, this is what my daughter uses for psoriasis.
Hmm.
So today he called me and wants to order a bottle of it.
Nice.
He's got psoriasis as well.
Hmm.
So this is what I'm talking about. When we start to define these products and they're going to start getting pushed out to our media side that we're almost ready to go and all that type of stuff. This is where it's going to help for us to start building data from patients and everything
Okay.
else that we need to because the most important thing in this industry for us is the data
Hmm.
and the products that are made. Because we need to be able to take care of the patient, and then we need to be able to have the right data to be able to help them in the most proper way down the road so that they can be the most successful.
All right.
Because a
Okay.
lot of people see a lot of things in a different way. I mean, we were just talking
Yeah.
about like one of the pills that you take as well,
Mhm.
that you were trying, and so there's so much different things that are out there, and and I'm curious to know. I had a gentleman. Maybe you can help me out on
Mhm.
it too. I had a gentleman that sent me a package from Mexico,
Mhm.
and it's supposed to be some very healthy thing.
Hmm.
Um, I don't. He didn't put any directions in there, so I don't have an
Mhm.
idea what to do with it. I can't get a hold of him.
Uh,
Mm,
so
So
that's what we have going on out in the market right now, Steph. Is you have a
yeah.
lot of products that are coming to market that basically do not have great labeling on
Mhm.
them, as far as how do you even use this product. So you want basically what you're talking about is making sure that you're with credible companies that are using good labeling,
yeah,
that you know what's in the product, and it's most food products, right? So at the beginning of that label, you might see it'll say water,
Mhm.
corn syrup, sugar. These are the ones that are most prevalent. So you
Yeah.
can
right.
basically take that same concept, that same idea, and apply it to your CBD products. You want to know, well, how much CBD oil is actually being put into this product,
Yeah.
how
Right.
much peppermint oil or whatever they're going to
Mhm.
use. You want to start to look at it in that and categorize your products in that way. Would I be correct or
Yeah,
not?
well,
Not so.
yeah, well, yeah, and you're correct because you're gonna weed out the ones that are really trying to screw the public out there.
Mhm.
Because these people go ahead and when they make a product, I mean, I don't think I brought it tonight, but one of the products, I mean, it had less than 5% in it.
Mhm.
I
Mhm.
mean, it's less than the water that 7-Eleven's putting in. So I mean, that person's really getting hosed.
So I just picked up a tincture here that says 3,000 milligrams, right?
Correct.
And see, on this label, we have ingredients: pure hemp oil, cannabinoid extract, and natural flavors. That's it.
Yeah.
That's it. So basically, that's what you want to be looking for, as least ingredients as possible, right?
Right.
And then it's when we get into percentages, and you know what? This is probably where my glasses would probably help.
Yeah, but it's so when
I,
you break down in those bottles how
uh-huh.
much
How
they're
much CBD is that? That's what
how
I'm
much
getting
they're
to there.
getting out of a
Yeah.
dropper. You got
Mhm.
to divide the
Right.
dropper divided by the amount that's in there to tell you how much on one of those shots that you're getting,
Hmm.
and and it makes a huge difference.
Yeah. So being realistic, those like places like restaurants or coffee places that are advertising maybe a coffee that has like CBD and they're really helpful and healthy and whatever. So if you drink really that one coffee,
or
it's not gonna do much for you. And probably like the product they're using is not like maybe the best quality.
Well, and you're going to see a couple things really that are different out there because the the water soluble product that's made, like we have one that's being made from our DNA company, and we have one that's being made from our FDA woman.
Mhm.
Hmm.
So the one that the FDA woman's partnered with is a doctor that developed the mapping system that goes through your body, which is similar to exactly what's happening on the other side from the DNA side. So that's going to make a big difference for people for their products and how it's hitting you, because when you talk about mapping and different things like that, you're talking about now how fast it drives into your system.
Right.
You
So,
know, so
so when we're talking about water soluble, I have a glass of beer like I often do on this show, with CBD in it. So basically, what are we saying when we say, hey, they're adding CBD to this? How quickly, which we know how quickly alcohol gets into the system. I've only had one glass. But when we add CBD, are we saying that a lot of our companies out there, they don't have the mapping, the technology to basically allow for the CBD to absorb quickly into the system? Or are we saying, yes, we do have that technology and it can absorb quickly into a product such as beer?
yes,
Cheers
to both of those.
to
Cheers.
the both of you.
But the reason I say yes to both of them is because you're looking at, um, in West Texas, there's a lady that makes a wine that has, hemp
Yes.
seed oil in it.
Yes.
Okay, which, I know you're just using the beer as an example,
Right.
but
Because I happen to have it
because
here.
of because of the liquor situation and the stuff that's out there, they're not allowing yet the CBD side of it. Now, my son, works for one of the larger distributors out there, and they're one of their partners is obviously looking in the Canada
Hmm.
aspect and some of the other areas. So so you are going to start to see the change on that. And if you look at Colorado, it's very progressive where they're moving into it in California.
Quick question, Jim.
Hmm.
And Steph, you can even, jump in there,
Mhm.
with some news as far as that. When we're talking about these different products, because I mean, I hear Coca-Cola experimenting, now with CBD in their drinks and whatnot, soft drinks. But when we're dealing with beer, wines, and whatnot, if I go out and I buy a product online, say one such as yours, the hemp oil, and I go ahead and I add it to just regular beer, is that going to harm me? Is it going to help me?
It's not going to
What
harm
is
you, and
okay?
isolate would probably mix a little bit better with it. But
Okay.
because you'll probably get that's a finished product already where it's at. So if you were to squirt it in there, you could drink it. You'll probably get some of the flavor from what it from what I was talking about,
Right.
depending on, if it's sweeter or not sweeter.
Mhm.
And obviously a little bit of cloudiness because that's mostly, I think, made from water, isn't it?
What? My beer?
Yeah.
Yeah.
And that's made from oil, so,
Right.
so,
And water and oil don't
you know,
mix.
so, well, and
We learned that.
they're going to have some processes that, that will. I
Right.
mean, because they're already making, vodka out there,
Mhm.
in California, with CBD in it, a lot of the, you know the uh, the places that are growing for winery and all of
Mhm.
that. They're all looking to add CBD into there. So California is probably the most progressive right now versus Colorado, who's really kind of the California will always believe that they were the first people that always had the marijuana side of it. You know,
Yeah.
but Colorado is the one that really jumped in full feet ahead and
Legal
and
on the
real
legal side.
on the legal
But you
side.
know me, I'm gonna always battle for Oregon and my man out there in Oregon at Amadula Farms. You know, I still say that you guys out there in California and Colorado, y'all came out to Oregon and talked to some of those farmers out there and grabbed a few strains or whatnot. But hey, I'm being a little biased. That's all. I
A
just want to
little.
throw my just a little. That's a
Just a
little.
little.
Yeah,
But
so
anyhow,
so next week we're gonna try to
but
pull
shout outs.
together a few people that are using the products
Yeah.
that can give us a heads up. I'm gonna try to see if I can get um, the guy that's looking for the shampoo, see if I can get his product in early enough.
Okay. That'll be
Um,
good. And definitely we want to invite the audience. We want to invite people who are currently using our product line to go ahead and come in next week and let us know, what what it's doing for you. Um, we have different people with fibromyalgia, um, chronic chronic stress.
Well, yeah,
Yeah, I
today
mean,
today was a chronic stress day, but
yeah, really.
Anxiety.
but your normal ones like chronic pain, you got MS, you got epilepsy, Alzheimer's, Parkinson's, IBS, Crohn's disease.
So hey, we're inviting the public out there. Hey, come on in to the Hemp Help Show, and tell us what your products, what they're doing for you, and how they're helping you, and more importantly, we're calling on those who have been, of course, using Jim's products to come out and talk to you all about the benefits of the products, and once again, how it's helping you, or even how it's not. So yeah,
Yeah.
that's looking like next week's show. We're getting around to that. We got any more news
Well,
going on
why don't we
around
go
the
ahead
world?
and take a break for a minute, and then
You
we'll
want to
come
take?
back, and
Okay, yeah.
on the other side we'll continue.
Okay, sounds good to me.
All right.
All right,
Eh,
ladies and gentlemen, we are back with the Hemp Help Show with your hosts Jim Lebo, Jerry Ra.
And Steph.
Yes.
Okay.
and stiff.
So I was another article I was reading was about marijuana use tied to lower rates of depression and suicidal ideation among PTSD patients. So they are saying that people suffering from post traumatic stress disorder
Hmm.
who consume marijuana experience significantly fewer depression episodes and lower rates of suicidal ideation compared to non-users, according to their study. So that's a big deal.
Mm-hmm.
Having like people with those big of problems, using only like products that you cannot have that much of side
So
effects.
I'm gonna throw something in there.
Go ahead.
That's kind of off the crazy, like being an African American living in America and getting shot at. That's post traumatic stress syndrome. Or we could talk about those, of course, in the military, which I was also in the military, post traumatic stress syndrome. We all suffer from that.
Mm.
So, therefore, once again, we have a product that will obviously help to relieve some of those stresses and whatnot that is going on. And I didn't mean to make light of it or anything like that or whatnot, but truly and honestly, what we're talking about is a plant that basically has the answer and the solution to a lot of elements that are going on within our nation right now. And if we get on the more serious side of it, it can help relieve that because right now we have soldiers that are killing themselves at a rate of what 43 soldiers per minute.
Mm-hmm.
So we have to start dealing with that, and post-traumatic stress syndrome is part of that. And not if these products here, they can help absolutely relieve that and bring a person back into a reality where they're able to function in this world. So I didn't mean to, be so um, I don't even know what a comedic with it, if that's a word. Like you always say, I'm not a PhD. However, that is what's really going on. along with the opioid addiction that's going on too.
Yeah.
But I apologize. I'm sorry, Steph. Let's get back on. Look, help me get back on track here because I'm like,
So yeah, I
I
think
think
it's
I went
really
down the wrong
yeah,
road
it's
there.
really important because we were saying you cannot overdose with these products. So
Right, you can't
they
over there.
you
There we go.
can. So all these other products, the antidepressant people are normally taking, those have like really serious side effects. So having this alternative medicine that would help with no cost to your health, that's a big deal.
I think a lot of people today are looking for solutions to, they're seeing what's happening with doctors. They're seeing what's going on, across the country, what the cost structures are.
Hmm.
I mean, listen, I gave a buddy of mine some of the salve and the lotion, and his doctor told him he needed a rotator cuff surgery, and 2 days later, all his pain was gone.
That you know what? That is huge because I personally know of several people who have had rotator cup surgery and or rotator cup replacement surgery who are going through rehab right now. And I did on a very low key. I said to them, you really need to try these alternative products instead of taking your normal. And what she did, because she was very conservative, and we
Right.
work at a very conservative company.
Right.
However, this person decided to go with the doctor and take the products, and she started having terrible dreams. All of the side effects that you hear at the bottom
Hmm.
of every
That.
prescription drug, you know, I mean, just everything from whatever you can imagine. So she immediately quit that, and she decided, hey, I'm going to try putting on a salve and just rubbing it in. And she realized she got some relief just from that. So this is what I'm saying. This is what I would project to the people out there who are listening to our show. Hemp helps is just that it will help, and it will curve some of the side effects that you would have from some of your other
Right.
uh,
Hmm.
uh, doctor
Medicines.
prescribed
Hmm.
drugs.
Yeah.
It would just
Pharmaceutical.
help. Yeah,
Hmm.
pharmaceutical
Yeah.
drugs. It would just help with that.
Yeah.
If you're not trying to be that person holding a knife at your spouse's neck and wondering why you're doing that. You see what I'm saying? Because that is really the effects of some of these prescription drugs that's going
Hmm.
on. And we have to start, once again, just getting back to reality, we have to start dealing with that from a very realistic standpoint. In other words, when the crackademic was hitting America, we didn't deal with it from a realistic standpoint. We dealt with it from a cultural standpoint. That's just cultural. Now that this opioid addiction is hitting America, now all of a sudden America is like, hey, we need to deal with this from a realistic standpoint. And so, in dealing with that, we have to deal with a real product or a real solution. And in that is the hemp plant.
Yeah. Well, and that's what the government really needs to see, because when you look at what can potentially happen with taking all these opiates away, can you imagine how much the cartel would like to bring into this country?
Exactly. And so we getting back
And
to
that's the wrong
Steph's.
stuff.
We're getting back to Steph point. Y'all just seen me rub the salve on. You just seen Jim use the roll on several times, and now I'm just gonna go ahead and give one of your products, which is a tincture, a try. And this is the what second product that I'm trying to show. I'm just trying to show the audience that you're not gonna overdose on this product at all. And here within the last 45 minutes, you've seen my host and I try different products or whatnot. And here I am live for you all trying these. And Jim, can you tell us a little bit about this product compared to the next one I'm going to take?
Okay. Well, there's two different flavors that we have in there. This one's going to be more of an RSO, a straight, almost like a Rick Simpson type oil. So it's not gonna have that sweetness into it. It's a little bit more
Tastes like rosemary, actually.
rosemary.
Yeah, this one tastes like rosemary.
Okay. So when you see the difference between
Y'all see that? That's like 3, 4 times I'm taking this.
now,
Okay.
now I'll tell you,
So,
my wife
so
takes this,
okay.
and she gets cancer spots because she gets a lot of melanoma,
Melanoma. Okay.
and so she puts that on there and puts a Band-Aid over it, and within a couple days, it's gone.
And this one is a little darker. If
That's the
you,
one that's
I
gonna be
wish
a
I
little,
wish our audience could see this. Like this one is a little darker than
Maybe
actually this one.
put it
yeah, because they're
there so you can tell.
Yeah. Let's try to do this. I hope you all can see that. Like one is like lighter, and you see how dark this one here is, and this one is lighter.
right. So it shows you the consistencies between the two of how they're produced through. One of them's stronger than the other, which is going to change how you process it. Do you notice how much sweeter that tastes?
This is sweeter. It's darker, and I can feel it. I can feel it like it's a little. It's light warming. It's
Yeah,
it's warming, and I can feel it hitting my system.
but it's got a wonderful
More,
taste to it.
yes, more than this one.
Yeah, because that has just more of like an oil, like you're putting
Right.
regular oil for a salad on there.
Now, if by the end of the show, y'all see me laid out like this, then you know we've been lying on hemp helps. But if I'm still standing and standing strong, then you know there is no way you can overdose on this product as long as there's no.
Yeah, it's impossible to overdose on any of this product. You can take as much as you want of it, however many times. I mean, I think a lot of the tincture part comes into it because people that do take a lot of pills during the day,
Mhm.
you got to have water, you got to have the pills,
Mhm.
so it's an extra stop, this and that. So where a tincture is real easy to just squirt it underneath the tongue, then it's got the ability to be able to work,
Okay.
So I just got a shoulder massage before I came in today with that,
Nice. And maybe
and it works
the
good.
show after the next show, we'll have a couple of massage therapists in here using different type of massage therapies on us as they put different hemp products on us, so you can see that we still haven't overdosed on these products.
Yeah,
That'd be nice, wouldn't it, Jim?
yeah.
I would like it. I would like it very much. Can we
There's-
make that happen?
Yeah, but there's no way to overdose.
There's no way.
But
What about the ladies that's going to be
in
doing the
Colorado,
massages? Can we overdose on that?
No.
No, not even that.
In Colorado, they charge $175 a massage just for hemp
Oh,
oil
shit.
massage.
I can go down and get me a massage for $35 and just bring my own bottle.
And going back, it's then important to like highlight that these products are not only to be used like on physical issues, also like mental, for anxiety, depression, PTSD. So
Yeah, which is really crucial. We have you know, a health crisis in this country with mental health.
Absolutely. Yes, we absolutely do.
You know,
And I have to bring this up because I work with the homeless. And, about 35% of our homeless do have mental health issues who are out on the streets or whatnot. And so I believe, and this is just my opinion, this is not, proven. Like I said, I'm not a PhD, not yet. That if we were to, and we still need to get into this as far as using food and changing the health as far as what we eat, as well as the products that we are using, such as hemp, which is a food. It is a food that we can use to help solve some of our mental health issues that we wouldn't be in the crisis that we are in. But really quickly, I just picked up another product. And since tonight, we are highlighting, the products that Jim Lebo has been taking, our host here, for the issues that he's had. Like I said, he's severed his spine, he's had his neck broke, and these are the different products tonight that you are seeing that he has been using in order to alleviate some of the pain, not some, mostly all of the pain that he's had. But I picked up something that I have not seen. It's called a terp stick. Can you kind of tell us what is a terp stick, and what is this product? What do
Well,
you do with it?
well, I mean, obviously a lot of the companies are trying to get away from the standard word vaping out there.
Yes, okay,
So
yeah.
this, what you're looking at is
We probably need to have a show on vaping, but
a
yes.
100%, CBD vapor. Now, listen, I'm going to be honest with you. I don't think that anybody's having any problems with cartridges that are coming from real companies, that are producing the products. I think you're finding more of the people that are having troubles that have those big mods that they use that they fill with tobacco, and then they may add maybe a THC or something, but there's no control of understanding what's happened to that product before it goes into there.
Hmm.
And and obviously somebody has been messing with the system out there because
Well, it's a
everything
very
was
new
fine for a
system.
long time.
Right, but yeah, I'm fine for a long time, and I have to give a shout out to Richard Rose, who was one of the pioneers to bringing hemp products to the forefront. But when we're talking about this cartilage here, so this is basically a cartilage that you would use in a vape pen that is coming from a reputable company. It's called Terp Stick. What are terps? For
Terps are the actual part that gets reintroduced back to the product as the flavor.
Okay, okay,
So,
nice.
so using that, like I like to use those like when I'm driving. I have a bad problem with, if I move my arm like for the mouse
Hmm.
and and then steering using, the arm that way.
Okay.
So that up and down motion and that twist motion, that's what starts driving that pain.
Okay.
Which sucks because I need to be able to use the computer and I need to,
Right. Absolutely.
so it creates, its own issue.
So, Steph, Jim, let's start wrapping it up
Okay.
for our people. We're coming to the end of the hour.
Yeah.
It's
So
been a
next,
very interesting hour. Yeah. Tell
yeah.
us
So
what's next.
next week, let's try to see if I can get the product in here fast enough. It's every Thursday, but tomorrow's already Friday, so
There you go.
let me see if I can get some product out, so that we can get in front of some people out here that can give it a try, that can give us a
Testimony.
good, clear testimonial of how well it's doing for them.
Well,
Okay.
one thing's for sure. I'm still here. I haven't fallen
Still
over.
standing.
I'm still standing. Steph?
I don't know. I'm excited to see testimonials of people. Um,
So, yes,
Testimonials people.
Yeah.
testimonial of people.
Testimonial people.
Yeah.
yeah. Well, I think what we'll do is we'll take a look at the different conditions that we want to find one person from. So we'll go through our social media side.
I do have to ask this. Are we going to bring on people who are going to do the other side of CBD, which is THC?
Well, we can't. We could bring them on the air, but we can't bring
Already
them into
high.
the studio for for right now.
Okay. Bring them into
And
the
when
studio.
that, I'm gonna ask my producer over there. Isn't that correct?
She's looking at us kind of
He's
crazy. She's
like,
like,
no.
we won't smoke. I won't see if I actually get high